It's important to understand and quantify adverse events in skilled nursing facilities because they're quite common, costly, and largely preventable. Adverse events are defined by the Office of Inspector General as events that are associated with harm. So the Office of the Inspector General, the function of that office in particular, is to detect fraud, abuse, and waste. And in this context, they determined that waste is harm, and therefore that was the purpose of doing this report. And they've done prior reports in the hospital setting, so this was the first time that they expanded from the hospital to the skilled nursing facility. The importance of the actual report itself was to broaden our understanding of the cost and the incidence and the consequences of adverse events, to broaden awareness and also to develop strategies to decrease their future occurrence. Before the report was released, it wasn't clear exactly all of the different types of adverse events that were occurring in skilled nursing facilities. We had some understanding about the impact of medication safety and adverse drug events. We had some understanding about other types of events, let's say related to falls. But what this did was to take a more comprehensive perspective of looking at all of the adverse events that could occur in this particular setting. As part of this report, they quantified each of the adverse events into one of three different types of buckets or criteria. One was adverse events related to medications. The second was adverse events related to general medical care. And the third was adverse events related to infections. The CMS Innovation Award was received by UPMC with the precise goal of reducing potentially avoidable hospitalizations. These hospitalizations are quite common and they're quite costly. We are one of 7 recipients of this award throughout the country, and there are 5 components of this award. They include the use of a nurse practitioner or enhanced nurse that maintains physical presence in the facility. The second is the use of Interact quality improvement tools. The third is individualized educational plans or programs and simulation. The fourth is pharmacy services to detect and manage adverse drug events and reduce potentially inappropriate medications such as antipsychotics. And the fifth is the use of telemedicine to assist with after-hours acute changes of condition to reduce potentially avoidable hospitalizations. One aspect that's particularly unique to the CMS Innovation Award here at UPMC is the use of telemedicine for after-hours management of acute change of condition. We found that we can avoid emergency department or hospitalization in approximately 40% of the encounters that we do through telemedicine. It's important to remember that adverse events in skilled nursing facilities are quite common, costly, and are largely preventable in this particular clinical setting.